spinal twist. So lay down on the floor. And if I'm stretching my left side, I'm going to bring my left leg across my body, trying to keep my right hip on the ground and my left shoulder flat on the ground. Now, the mistake that a lot of people make when they're doing this stretch is they grab that leg and they really crank on it, trying to force the leg deeper into the ground. And if you have stiff vertebrae or arthritic vertebrae and you're forcing that, you can quite easily hurt yourself. So we're not trying to crank your body past any normal range of motion that it's capable of at that moment. So one of the big important pieces, keeping your shoulder flat, hip on the ground, you're going to guide your knee down towards the floor until it can't move anymore passively. You're not trying to shove it down. Now, in this position, you're going to take a nice, big, deep breath. And as you breathe in, you're going to feel that stretch in your lower back. And as you exhale, you'll notice you can go a little bit deeper. So step one is to just breathe into your lower back, or if you're feeling it in the mid-back, for 1 to 2 minutes to get this to let go. Then we're going to engage our pales and rails contractions. So that pale contraction is going to be pushing up into your arm with your leg. The rails contractions is to contract your leg deeper down towards the ground, originating all of that contraction through that spine. So what that's going to look like, say I'm here, I've done my 1 to 2 minutes of breathing, my knee's getting lower and lower and lower to the ground. Now I'm slowly going to push my leg up into my hand with 20% effort, 40% effort, 60% effort, contracting the muscles throughout your body to be nice and strong, and 80% effort, as long as there's no pain through your hip or your spine or anywhere else, then you can give it a 100% contraction, where if you can move this leg back to the middle, I'll give you $1 million. So keep that leg here or that arm here, contract as hard as you can, 10 seconds. Relax, and you're going to notice that knee's going to go even deeper. So you do that 3 times, pushing the knee up into the hand, 20, 40, 60, 80, 100, as long as there's no pain, 3 times. And now the rail contraction, you're going to try to contract your leg away from your fist. And now sometimes if you do this well, you actually might get a cramp in that groin area. That's totally fine. But essentially what you're trying to do is to move that hip away from that hand for 10 seconds. And then once you're done, slowly come out of it. And then you can switch sides if need be, or if you're just focusing on one side, then you're done.